Hi everyone, get ready for expert tips, practice questions, and clear explanations, all designed to make your NCLEX journey smooth and stress-free. Subscribe now and let's make NCLEX success easy together. Question 11. A nurse is teaching a client newly diagnosed with peptic ulcer disease about dietary modifications. Which statement by the client indicates a need for further education? A. I will avoid spicy foods and caffeine. B. I will take my antacids right before meals. C. I should limit alcohol consumption. D. I will eat small, frequent meals throughout the day. Answer B. I will take my antacids right before meals. Rationale. Antacids should be taken 1 to 3 hours after meals and at bedtime, not before meals. Spicy foods, caffeine, and alcohol should be avoided, and small, frequent meals can help manage symptoms. Question 12. A nurse is preparing to administer morphine to a postoperative client. Which assessment is the priority before administration? A. Level of pain. B. Respiratory rate. C. Blood pressure. D. Bowel sounds. Answer B. Respiratory rate. Rationale. Opioids like morphine can cause respiratory depression. The nurse must assess the respiratory rate before administration. Pain level, blood pressure, and bowel sounds are also important, but are not the priority over respiratory function. Question 13. A nurse is providing care for a client with cirrhosis. Which finding requires immediate intervention? A. Jaundice. B. Ascites. C. Asterixis, flapping tremor. D. Confusion and altered mental status. Answer D. Confusion and altered mental status. Rationale. Confusion suggests hepatic encephalopathy, a life-threatening complication of liver failure. It requires immediate intervention to prevent coma. Jaundice, ascites, and asterixis are expected findings in cirrhosis but do not require immediate action. Question 14. A nurse is reviewing the ECG of a client with hypokalemia. Which finding is most commonly associated with this condition? A. Prolonged QT interval. B. Peaked T waves. C. ST elevation. D. U waves. Answer D. U waves. Rationale. Hypokalemia is associated with U waves, flattened T waves, and ST depression. Peaked T waves occur in hyperkalemia. Prolonged QT interval is seen in hypocalcemia, and ST elevation is associated with myocardial infarction. Question 15. A client with a recent stroke has difficulty swallowing. What is the nurse's priority intervention? A. Encourage the client to drink thin liquids with meals. B. Place the client in a high Fowler's position during meals. C. Provide a straw for easy liquid intake. D. Offer large bites of food to stimulate swallowing. Answer B. Place the client in a high Fowler's position during meals. Rationale. High Fowler's position helps prevent aspiration in clients with dysphagia. Thin liquids increase aspiration risk and should be thickened. Straws can cause the client to inhale liquids too quickly, increasing the risk of aspiration. Large bites are more difficult to manage for clients with dysphagia. Question 16. A nurse is caring for a client who has just undergone a total hip replacement. Which action should the nurse take to prevent hip dislocation? A. Keep the client's legs together at all times. B. Place a pillow between the legs when turning the client. C. Allow the client to sit in a low chair. D. Encourage the client to cross their legs when sitting. Answer B. Place a pillow between the legs when turning the client. Rationale. A pillow, or abduction wedge, keeps the legs in proper alignment and prevents hip dislocation. The client should avoid low chairs and leg crossing, as these increase the risk of hip dislocation. Question 17. A nurse is monitoring a client receiving a blood transfusion. The client reports chills, fever, and back pain. What is the nurse's priority action? A. Slow the transfusion rate. B. Administer acetaminophen. C. Stop the transfusion immediately. D. Notify the healthcare provider. Answer C. Stop the transfusion immediately. Rationale. Fever, chills, and back pain suggest a hemolytic transfusion reaction. The transfusion must be stopped immediately to prevent further complications. The provider should be notified, but stopping the transfusion is the priority. Question 18. A client with a history of deep vein thrombosis, DVT, is prescribed Enoxaparin, Lovenox. Which statement by the client indicates understanding of the medication? A. I will take this medication orally every morning. B. I will avoid using a soft bristle toothbrush. C. I should inject the medication into my thigh muscle. D. I will inject this medication into my abdomen. Answer: D. I will inject this medication into my abdomen. Rationale: Enoxaparin is a low molecular weight heparin given as a subcutaneous injection, usually in the abdomen. It should not be injected into muscle. The client should use a soft bristle toothbrush to prevent bleeding. Question 19. A client with heart failure is prescribed Spironolactone. Which dietary instruction should the nurse provide? A. Increase your intake of potassium-rich foods. B. Limit foods high in potassium. C. Take potassium supplements daily. D. Eat a high-sodium diet to prevent dehydration. Answer: B. Limit foods high in potassium. Rationale: Spironolactone is a potassium-sparing diuretic. Increasing potassium intake can lead to hyperkalemia. Potassium supplements should not be taken unless prescribed. A high-sodium diet is not recommended for heart failure. Question 20. A client with asthma is prescribed albuterol and beclomethasone inhalers. What is the correct sequence for administration? A. Use the beclomethasone inhaler first, then the albuterol inhaler. B. Use the albuterol inhaler first, then the beclomethasone inhaler. C. Use both inhalers simultaneously. D. It does not matter which inhaler is used first. Answer: B. Use the albuterol inhaler first, then the beclomethasone inhaler. Rationale: Albuterol is a short-acting bronchodilator that opens the airways, allowing better absorption of the corticosteroid beclomethasone. Using beclomethasone first would be ineffective because the airways may be constricted. Let's know how many questions you answered correctly by dropping it in the comment section below. Go to our previous videos to test your ability. Please subscribe, like, and share. We love you.